Hi, I'm Dr. David Haase, and you may know me as the Curious Physician. And I'm deeply interested in you having more good days. And I'd like to discuss a really important topic that's in the news lately today about Matthew Perry's death and its association with ketamine. Because ketamine is a substance that has a great power and has great power to heal and help when in the right hands and in the right setting. So let's talk about this a little bit. So I like to categorize everything with regard to health and well-being in one of three categories. I think everything falls into one of these three categories. The first is it a medicine? A medicine is that which creates health. Secondly, is it a drug? A drug is that which creates control. Or thirdly, is it a poison? That is which creates harm. And I think everything falls into those categories. Let's think about water for a second, right? Water is definitely a medicine. Without it, we're all dead. It creates health for us. It enables our body to create health. Water can be a drug. It can be, tightly metered to control blood pressure in a hospital setting, and we can increase blood pressure and control the body when it's going out of whack in another way. Very useful at the right time. And it can also be a poison. Drinking too much water can give you water intoxication, cause seizures, or being in water, underwater, unable to breathe, causes drowning. Too much, too little can both kill you. So it's important let's take a look at ketamine in this same way. Because ketamine can definitely be a poison. Too much ketamine in an unobserved circumstance can absolutely cause a person to become unconscious and unaware. Ketamine can be a drug used to control symptoms that are disturbing, such as pain. We use it in the emergency room all the time. Ketamine can be used to as a continuous basis to make that individual less responsive to pain. And ketamine can also be a medicine where using it judiciously can create a learning experience, a neuroplastic experience that can lift somebody out of PTSD, anxiety, depression, can give one a new focus and an awareness of life and new tools with how to move forward. So as we think of ketamine, everything depends upon the context, where you are, the dose, the timing, the appropriateness. And if we sit back and think about what killed Matthew Perry, was it ketamine? It was actually water. Water is what poisoned Matthew Perry. Because he was given, we now know, big dose of ketamine and then went into a hot tub. And he became disassociated, unaware of where he was, slipped underneath the water and drowned. I mean, that is the toxicity of water in the wrong place at the wrong time. Now, I'm going to tell you what, this was a terrible misuse of ketamine. This is not given under controlled circumstances by experienced individuals with appropriate monitoring. It's wrong. And that's incredibly tragic ending. But just like we would not, we're not going to blame water for this incident. Neither can we blame ketamine. Those are both tools. How are the tools used is what's the most important facet. And I've gotten to see people getting their lives back in ways that are absolutely profound with the use of IV ketamine and the supportive therapies that surround that. So it's really important to understand that. How we do this at MaxWell Clinic is we provide ketamine at very controlled doses with one-on-one care with an RN. This is being given IV. We monitor cardiovascular health. We are constantly there to nurture and look after that individual who's going through this experience. Some individuals really have a very benign experience. Others, this is a very emotional experience where they're working through something that has kept them stuck for a very long time. So you don't just need physical support, but you need mental, emotional support, and also, dare I say, spiritual support of the caring of a person, recognizing that you're being brave and you're doing this work to be a better human long term. So whenever you're thinking about a therapy, it's important to not vilify the tool, but to recognize that it needs to be used correctly. It's very natural for us to feel concerned when hearing news like this, and scared, and have a severe distrust around this molecule that seems so unfamiliar and seems to be, so strange. And I would agree, it's odd. I mean, it's the idea that we could move forward through many of our brain stuck patterns, such as depression, anxiety, PTSD, and a host of other things that respond to neuroplasticity with this one little molecule, is really pretty amazing. And it is being misused by some people in some segments. It is being diverted. I think we have to take that very seriously. But this molecule can actually be helpful for the treatment of addiction in the right hands in the right time. So let's really strive to support each other in these processes. Let's continue to work to make medicine better and better, to make sure that the right therapy is being used in the right person at the right time, in the right dose, and that support is available surrounding that experience. So I hope this has been helpful in giving you a little different perspective, and maybe you'll think about some other things in your life. Is it a medicine? Is it a drug? Is it a poison? And you realize that context matters tremendously. So these nuanced understandings don't make the clickbait world, right? If you want to, if you really want to get somebody excited or have somebody follow you, you make a very strong statement that this is right or this is wrong, and you know what? It depends. And caring for people deeply is what is most important. That's what we strive to do at MaxWell Clinic. And if we can be of any help, please give us a call. Take care.